The Ministry of Health, together with the Global Alliance for Improved Nutrition, GAIN, has revealed shocking information that most of the secondary schools in and around Kampala feed students on foods that cause non-communicable diseases. The Director of Public Health at the Ministry of Health, Dr Danial Kyabayinze, says findings from various schools in Kampala show meals provided to learners did not meet the national school feeding guidelines.
Almost half, that is 49% of the female learners, did not receive the minimum dietary diversity for women and are at risk of micronutrient deficiencies. There was a high consumption of foods that increased the risk of NCDs, where 7 in every 10 learners consumed these foods, sweet foods and salty snacks, while 6 in every 10 students consumed deep-fried foods. School canteens provided more NCD risky foods, and they need to be regulated.
The assessment was carried out in 4,008 adolescent learners aged 15 years and above from 60 private and public secondary schools.
Meals provided to learners in boarding schools only meet less than half of what the energy requirement for the learners. Although meals provided to learners in a day schools meet the recommended energy, the requirement of 30%, this may be low considered the time they spend in school. For energy, for male, we need 2,800 kilocalories per day, and we saw in our study they are only getting 30% of that from the schools. And for female, we need 2,500 kilocalories for females per day.
Nutrition affects learning outcomes. And if you are sick, you spend most of the time as a child sick or hospitalized, you don't achieve your academic potential, but also as a family where the child comes from, they will have to spend a lot. But extrapolating that or looking at a national picture, if you have many children who are sick and they're having such kind of condition like hypertension or what, the bills will increase spent on managing such conditions because they take long, they are chronic conditions.
The Dissemination findings report shows micronutrients such as iron, zinc, vitamin A and other B group vitamins were inadequate in the school meals.
World Health Organization recommends only 5 grams of salt per day, but it was found that the learners consume more than the recommended amount, which exposes them to non-communicable diseases like high blood pressure.
Students spend most time at school, the reason why government has a policy framework that fosters good health and nutrition. Zahara Abigaba, UBC News.